Hello, thank you to SFU's Public Square for the opportunity to talk about the AIRWISE Lung Health Communication Study. This presentation is being delivered from the unceded traditional territories in the Musqueam, Tsleil-Waututh, and Squamish First Nations. My name is Sonya Cressman. I'm a health economist at the Center for Clinical Epidemiology and Evaluation and an assistant professor in the Faculty of Health Sciences here at SFU. Now, the AIRWISE story began about a decade ago with my colleagues in the Pan-Canadian Early Detection of Lung Cancer study. This team of researchers came together to detect lung cancer at an early stage and cure it with surgery before it developed into a more dangerous form of lung cancer. A decade later, we now know that the lung cancer screening works and that it could translate into thousands of lives for British Columbians being saved. And so the provincial government launched a program last year for the first lung cancer screening program in Canada. This program is set to start in the spring of 2022. There are reasons to be concerned about inequities in access to the new lung cancer screening program and outcomes from lung health services in general. Population health research has shown us that the risk of developing lung cancer depends on social position. For example, people who are Black, people who have low income, and people who are women are more likely to develop lung cancer. However, they are less likely to have access to preventative lung health services, and the outcomes from public health services are generally poorer. There are also inequities when you think about the opportunity cost of investing in more effective health services that could be targeted to these populations. And for these reasons, I convened the AIRWISE study to extend the reach of preventative health services that are known to be effective. The study was funded this year by the Michael Smith Foundation for Health Research. We were funded to convene a group of community advisors to co-create a lung health risk communication platform and to develop community coalitions to implement the platform across BC in the future. We have recruited 10 community advisors who have knowledge or experience about lung health from across the province. There are 2 from each of the regional health authorities, and together we will meet with a group of scientific advisors who have expertise in all different areas of lung health. Through the BC Support Unit and the Legacy for Airway Health, we have begun to develop some critical community coalitions. We are working with the First Nations Health Authority to bring Indigenous leadership to the AIRWISE study, and with the Health Equity and Population Health Unit at Fraser Health to understand the barriers and facilitators that newcomer populations experience in accessing lung health services. I'm really grateful for the community advisors that have agreed to join this study as research team members and the scientific advisors who are volunteering their time for this purpose. I'm also really grateful for the awesome support staff, research support staff at SFU and the knowledge mobilization experts at SFU and the Legacy for Airway Health who've helped us get up and running. The study is just about ready to launch, and I'd love to hear from you if you'd like to contact me at the email below. Thank you for your time and attention.